From the JAMA Network, this is JAMA Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinion featured in JAMA.
Hello, and welcome to this JAMA Author Interview. I'm Dr. Linda Brubaker, Deputy Editor for JAMA, and today I'm joined by Dr. JoAnn Pinkerton, Professor of Obstetrics and Gynecology and the Director of Midlife Health at the University of Virginia. Dr. Pinkerton and her co-authors contributed an impactful JAMA publication titled Elinzanetant for the treatment of vasomotor symptoms associated with menopause. Welcome, Dr. Pinkerton.
Thank you, and I'm really excited to be here to talk about something that affects so many women, which are hot flashes.
Yes, we know menopause happens. It happens to about 1.3 million women in the United States each year, and 20% of the American workforce are women between the ages of 45 and 64. You pointed out in the article that approximately a third of postmenopausal women experience moderate to severe vasomotor menopausal symptoms or hot flashes. So tell us about why you did this study now.
So it turns out that 80% of women have hot flashes, but a third of them are very severe. They can last 5 to 10 years or more after the menstrual period, and they're more common in Black and Hispanic populations compared to those who are white, least common in Japanese and Asian populations. But what we've learned is that the most disruptive symptoms are the hot flushes and night sweats, vasomotor symptoms, sleep disturbances, and the mood changes, and they can significantly disrupt a woman's daily life. So we need effective treatments. And although it is true that hormone therapy works very well for hot flushes, not all women can take or want to take hormone therapy. And so we need additional effective, well-tolerated non-hormone treatment options. And Elinzanetant is a new investigational compound that works by blocking the NK1 and NK3 receptor signaling, and it's involved in temperature regulation and sleep pathways. So we hoped that we would help hot flushes and potentially sleep and mood.
Thank you, Dr. Pinkerton. So you combined the report of two very similar trials in this single manuscript, which will really be a benefit for readers. And you assessed efficacy and safety of this medication compared to placebo. So could you tell us some of the findings?
So it was two pivotal trials, and the reason we put them together was that the findings were robust and so similar across 77 different sites in each of the trials, and it was multinational. So we were excited to find similar results, and what we did find was that Elinzanetant achieved a statistically significant reduction in frequency and severity of vasomotor symptoms over 12 weeks compared to placebo. And that number was that by week 4, it reduced the frequency by 55 to 57%, compared to placebo effect about 31 to 35%. And then at week 12, it was even more effective, reducing the hot flushes by 65 to 67%, compared to placebo at about 42 to 45%. And the efficacy was maintained, with over 80% of the participants in the Elinzanetant group achieving at least a 50% reduction in vasomotor frequency by week 26, including those who were on placebo and then switched over to Elinzanetant after week 12.
Well, I think these findings must have caused great excitement amongst the investigators and, of course, the participants who responded to this therapy. Could you talk just briefly about what you attribute the placebo response to?
In almost all vasomotor clinical trials, there is a placebo response, and it varies from 30 to 60%. We think part of it is just being in the clinical trial, attention being paid to you, and that potentially maybe just over time some have been improved. And so that's why it's so important to do randomized blinded controlled trials, because you have to show that you're better than placebo in order for it to make a difference for women.
So were there any surprises in the findings of the study or the conduct of the study?
I was very surprised at how robust the data was within the two trials, because they were similar design, but performed in different populations with different investigators. And they both found that this Elinzanetant, which is the first dual neurokinin 1,3 receptor antagonist, showed this efficacy and safety. And I also think that it was interesting because of how good the safety profile was.
I really appreciate how you talked about the different study populations. Could you talk a little bit about the generalizability and any limitations on the generalizability that investigators and clinicians should know about?
So this was a multinational trial, so it involved both sites in the United States and in Europe. And we worked hard to enroll underserved or underrepresented populations. But having said that, our participants were primarily white, with 12 to 19% Black participants and 10% Hispanic or Latino participants. One of the other limitations is that these were healthy women who were not on CYP2A1 inhibitors. And we limited that not because of an interaction concern, because it's a different mechanism, but because different types of low-dose antidepressants can improve hot flushes. So primarily Caucasian, it was only 26 weeks with a 4-week follow-up. And then we used patient-reported outcomes. So it was an electronic diary recording. And that's important because you can do like little monitors on the fingers, but we wanted to get real life what's happening for women. And our placebo effect was 40%, which is, as we've said earlier, similar to other hot flush trials. And they were not required to have sleep issues, and that's going to be looked at a later trial.
Dr. Pinkerton, what do you think is the clinical impact of these trial results?
Well, the study results from OASIS 1 and 2 suggest that this investigational product may be an effective and safe non-hormonal treatment to meet the significant needs of menopausal women. And these positive study results shown in OASIS 1 and 2 reinforce the potential of how well it works and the hope that it's going to be safe and effective as a non-hormone treatment for women who have a triad of both moderate to severe hot flushes, sleep disruption, and decreased menopause quality of life.
Some clinicians may wonder whether hormonal therapy could also be used at the time of this therapy.
When we were enrolling in this study, women could not be on hormone therapy if they had been on it previously. So we don't have any data suggesting that you could use the two together. And, I think the benefits are quite different. Hormone therapy treats the hot flushes. The advantage is that it also provides some effect on prevention of bone loss, on, lipid profiles, and also on vaginal symptoms, versus this medication, Elinzanetant, is going to be primarily aimed more at women who can't take hormones or choose not to. So maybe women who've had breast cancer or have had blood clots or stroke. And then it's going to be, again, treating flushes and hopefully sleep and mood for those women. But it's not going to improve or worsen bone density, affect lipids, or help the vagina.
Dr. Pinkerton, could you discuss the safety profile?
The safety profile of Elinzanetant was favorable. Headache and fatigue were the most frequent treatment-related adverse events, and they improved over time. And interesting, when we switched the group on placebo to Elinzanetant, they had lower numbers of both fatigue and headaches, and all of those numbers decreased over time. There were no incidents of endometrial hyperplasia or malignant neoplasm identified, and no cases of drug-induced liver injury that was causally related to Elinzanetant. We had a liver safety data monitoring board that told us that there was nothing that was causally related, and there were no significant lab test abnormalities, including liver tests, and that's in line with findings from prior phase 2 clinical trials.
I suspect there's other work going on in this area. Could you talk about any other work, especially important trials?
So we await the full results from the 52-week phase 3 randomized placebo-controlled trial to further confirm the safety and long-term efficacy. And then there is a trial called OASIS 4, which is another phase 3 clinical trial in Europe. And this is menopausal women with hot flushes who have either breast cancer or are at high risk. And they can be on tamoxifen or aromatase inhibitors. And they are working harder to get the ethnic groups. And this is an ongoing trial that's going to be extended. And this is one of the groups that we really want to know if it's safe and effective for. So that's really exciting. And then there's also a phase 2 study called Nirvana, where we're looking at the potential of Elinzanetant to address sleep disturbances. So in our population, they were not required to have significant sleep disturbances. We did find that, and it was improved, particularly compared to placebo. But in the Nirvana trial, we'll be looking at women who are complaining of sleep disturbances and then seeing how effective it is.
So tell us, why are you so excited about this?
I am excited about this potential of Elinzanetant to become available as a safe and effective non-hormone treatment because I think it's going to address that triad of hot flushes, night sweats, sleep disturbances, and mood symptoms. So it's going to be a little bit more holistic non-hormonal treatment option. And so it's going to be a treatment option maybe for women who've got estrogen-sensitive cancers, blood clots, migraines with aura, significant endometriosis, elevated risk of breast cancer, those who are afraid of hormone therapy, those who don't want to take it, or those who are ready to discontinue it. And I think we just really need a variety of treatment options for women. And women want to be informed to what they want to know the benefits of the therapies, the risk of the medicines, and the risk of not taking them on their future health. And so this is going to give them a great option if it becomes available.
Well, thank you so very, very much. This has been fascinating. I am Dr. Linda Brubaker, and I've been speaking with Dr. JoAnn Pinkerton about the new treatment for moderate to severe menopausal symptoms. You can find a link to this article in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Musisi at the JAMA Network. Thanks for listening.